When taking Acidophilus Casei Rhamnosus Capsule, delayed release, Enteric Coated Capsule, delayed, EC, it's important to follow the directions on the product package. Depending on the specific product, the dose may need to be swallowed whole, chewed, sprinkled onto food, or mixed with liquid. If you're using the liquid form, be sure to measure the dose carefully using a special measuring device/spoon, and not a household spoon. Some probiotic products contain live bacteria, such as bifidobacteria, which may be affected by antibiotics. It's recommended to take any product containing live bacteria at least 2 to 3 hours before or after taking antibiotics, so be sure to follow the directions for your specific product. If you're using this product for diarrhea due to antibiotics, do not use it if you have a high fever or for more than 2 days without consulting your doctor. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. If you experience increased stomach gas or bloating, let your doctor or pharmacist know. Serious side effects may include signs of infection, such as a persistent cough, high fever, or chills. Rare but serious allergic reactions may include rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. For medical advice about side effects in the US, call your doctor or report to the FDA. In Canada, call your doctor or report to Health Canada. Before taking Acidophilus Casei Rhamnosus Capsule, delayed release, Enteric Coated Capsule, delayed, EC, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions or other issues. If you have diarrhea lasting more than 2 days, a weakened immune system, recurring vaginal infections, or recurring urinary tract infections, it's important to consult your doctor or pharmacist before using this product. Liquid products, foods, powders, or chewable tablets may contain sugar and/or aspartame, so if you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances, be cautious and talk to your doctor or pharmacist about using this product safely. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this product if clearly needed and discuss the risks and benefits with your doctor. It is unknown if this product passes into breast milk, so consult your doctor before breastfeeding. When taking Acidophilus Casei Rhamnosus capsules, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without consulting your doctor. Some medications that may interact with certain probiotics include antibiotics and antifungals, such as clotrimazole, ketoconazole, griseofulvin, and nistidine. Always consult with your healthcare provider before starting Acidophilus Casei Rhamnosus capsules to ensure it is safe for you to use. If someone has taken too much of this product and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical attention. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Remember to keep all of your medical and lab appointments. It's important to note that some brands of this medication may also include other ingredients, such as fiber or inulin. If you have any questions about the specific ingredients in the brand you are using, be sure to ask your doctor or pharmacist for clarification. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at your regular time. Don't take double the dose to make up for the missed one. When it comes to probiotics, such as Acidophilus Casei Rhamnosus capsules, it's important to store them properly. Some may need to be refrigerated, while others should not be. Always check the product packaging for specific instructions on how to store your probiotics. If you have any questions about storage, don't hesitate to ask your pharmacist. And remember, it's crucial to keep all medications, including probiotics, out of reach of children and pets. When it comes to disposing of expired or unused probiotics, be sure to follow the proper guidelines. Don't flush them down the toilet or pour them into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to discard them. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.